What an honor it is, Dr. Shealy, to sit here with you today and look at the Graduate Institute through your eyes.
Well, it's a pleasure to be back again. The most important thing in the world is human consciousness. And the humanistic movement, the transpersonal movement, the movement towards holism in general, looking at the integration of body, mind, and spirit. And the Graduate Institute has been at that from the beginning. Sure. We need that more than anything in the world. Conventional medicine and conventional psychology are still stuck in the Middle Ages, in my opinion. We need to move forward and teach people how to do this for themselves. Every person has the capability of moving beyond stress into, well, what they came to do, which is actually to help other people. That's why we're here. And it's various forms of stress that prevent people from reaching that potential.
We very often find that the individual who's drawn to the Graduate Institute has from a very early age been drawn into the field of service.
Well, of course, again, is my opinion is there is only one purpose in life, to help other people. And that's love. That's the definition of love, doing good to others. And so the people who made this glass are just as important as I am. That's a service. The people who purify the water are just as important. Everything is important because that allows us then to focus on helping people who haven't been able to get there yet.
And we find, Dr. Shealy, that those that have been drawn into service, and whether it's service of education or service of healthcare, or in general in life, service to your family, there's a need, maybe more now than ever, to begin to learn self-care.
Well, of course, that's been my method, if you will, for the last 45 actually years. I looked at what was happening in conventional medicine with people with severe chronic pain. And we were doing something that was truly medieval, cutting the spinal cord with a piece of a razor blade. I mean, it was so barbarian. So when I finished my training in neurosurgery at the Mass General, I spent 3 years studying pain physiology. And I came up with the idea that we could control it by stimulating the spinal cord and the skin. And when I first introduced that, because my work was originally done in animals, I was like, oh, you don't know what you're talking about. But a few years later, when I introduced just 8 patients, every neurosurgeon in the room was ready to do it. But all of a sudden, when I got this introduced, I'm being sent hundreds of people who fail conventional medicine. And unfortunately, they're so damaged. By the time I saw them, 5, 7 operations, narcotics, tranquilizers, I was only selecting 6% of them. And that's why I had to start looking at, well, how do we help these people who are not candidates for my new discovery? And so in 1971, I started a positive behavioral modification program. And I was already doing acupuncture. And then I learned about autogenic training and biofeedback. And that led me to look at the very broad picture. There's so many tools that are really the transformative ones, the spiritual connection and the humanistic connection. And so over the years, I've worked with what I call retraining the nervous system. And you can retrain the nervous system at any age. You can learn just as tying your shoes. One of my favorites is remembering at age 5, I think, when I learned to tie my shoes, what a strain it was. And now I can retrain people to deal with unfinished business, because it really is anger, guilt, anxiety, and depression that prevent people from moving on in life. And drugs are never the answer for those. And regular medical procedures are not the answer for those. So they have to learn to detach and separate themselves from the distress and focus on creating, well, peace. And I started with a very simple thing called autogenic training. It's been around since 1912. And that's why I went back and got a PhD in psychology. And I would have gone to the tradition. Of course, Graduate Institute didn't exist in 1974. I went to Humanistic Psychology Institute, which became Saybrook, which of course also relates to Connecticut,
Absolutely.
the founding of humanistic psychology.
Absolutely.
And my dissertation was working on the broad field of self-regulation. And I read 350 books from all over the world about how you can do it. I mean, yoga and Tai Chi and Qigong and you know, Raja Yoga, interestingly, which is the spiritual form of yoga. According to Dr. Elmer Green, who introduced biofeedback, autogenic training is a Western form of Raja Yoga. I began adding these things to it, which I now call biogenics. And it's my belief that with learning to relax, learning to be here, now, in present time, and learning to relax. Most people walk around every day even ignoring those messages from their body that are telling them to let go.
Correct.
So the first phase of retraining the nervous system is to learn what I call sensory biofeedback, getting the sensations that tell you, I need help. And so we developed a wide variety of tools for letting go of those tight, painful, or even absent feelings where everything is blocked. Wilhelm Reich said that it's a decreased blood flow that leads to every illness. And of course, when the muscles are tightened, they don't get adequate blood flow. Even thyroid function, 50%
Correct.
comes from blood flow. And so we train people to learn to control mentally pain. Now, you don't do that if you don't know the cause.
Right.
But once you know that the cause is taken care of, then you can train yourself at literally to turn off pain mentally. Then you're ready to get rid of balancing your emotions that aren't fixed. And so you get rid of or learn how to deal with anger, guilt, anxiety, and depression. And when you do that, you're ready for spiritual attunement, connection with your real self, the soul, and God.